Hi, my name is Carrie Bennett, and I'm going to talk to you today about orthopedic impairment. I'll give you the definition, the causes, and some things as teachers what we can do to help students with the orthopedic impairment. Orthopedic impairment means a severe skeletal, muscular, or neuromuscular impairment. How do we identify an orthopedic impairment? The referral characteristics for a student with orthopedic impairment fall more into the area of physical characteristics. These are paralyzed, unsteady gait, poor muscle control, or loss of limbs. An orthopedic impairment may also impede speech production and the expression language of the child. Orthopedic impairment affects the abilities of a child to move, use, feel, or control certain parts of their body. Causes of orthopedic impairment range and include genetic abnormalities, birth trauma, diseases, injuries, amputation, and contractions from burns. Well known conditions include spinal bifida, scoliosis, and the main one is cerebral palsy. Educational occupational impairment means there is a motor disability stemming from the medical conditions spoken about before. These affect the children's ability to access their education. What are types of occupational impairments? They're sporadic, which is very tightening of muscles occurring in one or more muscle groups that result in a stiff, uncontrollable movement. There's movements are contorted, abnormal, and purposeless. This is athedos. There's also atrex, which is poor balance and equilibrium, in addition to uncontrollable voluntarily movements. There is also mixed, which could be any combination of any of these types. The impact on learning. The specific impact on learning of an individual is con- contingent upon the disease, its severity, and the individual factors. Two individuals with identical diagnosis may be quite different in terms of their capabilities, which we know this is true with a lot of students that have special ed type things. Just because one student is diagnosed with the same thing as another student does not mean that those two students are exactly the same. Many students with orthopedic impairments have no cognitive learning, language, or sensory issues. However, individuals with neuromotor impairments have a higher incident of additional impairments, especially when the brain is involved. For most students, orthopedic impairment, the impairment on learning is focused on a combination necessary for the student to have access to academic instructions. Teaching strategies, as with most students with disabilities, the classroom accommodations for students with orthopedic impairment will vary depending on the individual needs of the student. Since many students with orthopedic impairment have no cognitive impairment, the general education and special education should collaborate to include the student in the general education as much as possible. In order for the student to access the general curriculum, the student may require these accommodations. Special seating arrangement to help them with position and movement, instruction focused on development for gross and fine motor skills, securing suitable ways to communicate, which could be within a device, awareness of medical condition and its effect on the student, much as some of them can get tired very easily. So you just need to know what they are. Because of the nature of the occupational therapy, um, not occupational therapy, sorry, on the orthopedic impairment, there is other people that might have to come in, which would be physical therapy, occupational therapy, speech language might need to come in. Also, they might need an adapted physical education teacher, a teacher that is specializes in certain PE type things for the student. Other therapies could be massage therapy, music therapy, and they could be a combination of one, two, all of these. It just depends upon what the student needs. Um, the, ex- um, the assistant for technology, due to the various language levels of severity of orthopedic impairment, multiple types of assistant technology may be used. As with any student with a disability, the assistant technology would need to be addressed. A need for the student to be able to access the educational curriculum. For students with orthopedic impairment, this falls into three categories. They could need a speech recognition software, screen reading software, also academic software packages for students with disabilities. It just depends upon what they need and what type of device they could possibly need. Devices for positioning and mobilization. The assistant technology devices focus on helping the students participate in the education. These devices could include canes, walkers, crutches, wheelchairs, special exercise equipment, or also special chairs and desks or table for a proper position. The fact sheet that I found was at the ksde.org website. It looks like this. It's a fact sheet that shows about the orthopedic impairment, and it was great information to find. But you can just go to that website, and it is for the Kansas State Department of Education fact sheet. So I'm sure there's more fact sheets on different type of impairments other than just the orthopedic. So I hope this helped you. Thank you very much.